You can see they have a sealed off window here, and it's sealed off from the rest of the room.
If anyone in San Diego were to be diagnosed with Ebola, they'd come here. This unit is sealed off from the rest of the hospital. It keeps Ebola from escaping with negative air pressure,
There's negative flow,
advanced waste disposal, bedside lab space, and nurses observing everything from the outside.
You guys need any supplies, or are you good on everything?
In a separate room, nurses receive instructions on the proper way to remove protective spacesuits.
Sitting in chair 1.
Okay, at this point, can you please begin to remove your shoe covers?
It sucks air through, cleans it up, puts it through the tube, and then it blows it into the hood.
Dr. Jay Doucette is the medical director for emergency preparedness. He says volunteer nurses have received in-person training on how to safely care for an Ebola patient.
We've got about a little over 50 people trained. We like to have closer to 100 trained, all of our volunteers trained, but we could take one now if we had to.
But some staff still have concerns about what happens outside this unit.
What if somebody walks in the front of the hospital and asks to be directed to the emergency department? Not every patient comes in the traditional route.
Michael D. Jackson is a nurse in the emergency department and vice president of the union National Nurses United. Dr. Doucette says emergency room nurses have received additional training on screening for Ebola and transferring patients to this isolation unit. He believes the hospital is prepared to handle an Ebola patient wherever they might show up. So far, there have been no confirmed cases of Ebola in California. David Wagner, KPBS News.